Chapter 6, Health Promotion of the Infant. Growth rates can vary in children, but typically by 6 months old, the full-term newborn will double their weight and triple their weight by 1 year. Weight gain in formula-fed babies is slightly higher than breastfed babies. During the first 6 months, infants increase their birth length by about 1 inch per month, and then the next 6 months, it will be approximately a half an inch per month. By 1 year, most infants have increased their length by 50%. Head circumference will increase about a half inch per month. The posterior fontanelle will close by 2 to 3 months, and the anterior fontanelle will close at 12 to 18 months. Brain growth is rapid during the first year and is dependent on nutrition and the function of other systems. The lungs increase their volume 6 times from birth. The trachea remains small during infancy. The trachea, bronchi, and bronchioles do grow in that first year, but the infants are still at risk for respiratory illness and choking. The eustachian tube is short and relatively horizontal, increasing the risk for middle ear infections. The heart doubles in size. The heart rate will slow down and the blood pressure will increase during the first year. For the first 3 to 4 months, the infant receives maternal antibodies to fight off infection. They will produce their IgG, which is needed to fight infection, shortly after birth, but even by 1 year of age, they only have about 60% of the adult portion of IgG. Breast milk will provide more IgG to help fight off infections as well. At birth, the infant's stomach is about 10 to 20 mLs, but by 1 year of age, it is about 200 mLs. The body is able to digest and absorb fat, will reach adult levels at approximately 6 to 9 months. Kidneys are not effective for filtering or concentrating urine until 1 year of age. This puts infants at risk for fluid and electrolyte imbalances. By 2 to 3 months, the infant can lift their head to a 90 degrees in the prone position. The Moro and rooting reflex will disappear by 3 to 4 months. Most infants play with their feet by 4 to 5 months. Anticipatory guidance is needed on baby-proofing the house. Please see the patient-centered care teaching box in your book. During the 5th to 6th month, the infant will readily reach and grasp objects. They can turn from abdomen to back at this point and will rock back and forth as a precursor to crawling. By 6 months, they can sit alone by leaning forward on their hands. This is known as a tripod position. They can roll from their back to their abdomen. At 6 to 7 months, they transfer items from one hand to the other. They can also grab things with their whole hand and put them in their mouth. So be careful, there can be choking hazards. By 9 months, the infant can do the pincer grasp, which is where they use their thumb and forefinger to pick up items like Cheerios. Once again, this can be a choking hazard if they find small items within reach. They can wave bye-bye at 9 months and clap their hands. By 1 year old, they can drop an object into an offered hand. Most at 1 year can balance well and walk while holding on to someone's hand. For the first 2 years of life, the cognitive development begins with egocentrism. This is where they are self-absorbed and cannot view the world from anyone else's vantage point. According to Piaget, infancy is part of the sensory-motor stage. They experience the world through their senses. They learn from trial and error. By 9 months, the child will be able to realize that an object exists even though it's out of sight. This is known as object permanence. An example is a toy that the child saw is now hidden under a blanket, and they know to look under the blanket for the toy. Playing peekaboo is the same concept. Motor activity will parallel cognitive development. We can educate parents to offer a variety of stimulating activities to enhance their cognitive development. We also want to encourage them to maintain familiar routines so they can develop a sense of security. Infants show a preference for high contrast colors and pastels and are not highly distinguished until about 6 months of age. Depth perception typically starts at about 7 to 9 months, which is the same time the infant typically becomes more mobile. By 4 months, an infant should be able to turn their eyes and head towards a noise coming from behind. By 10 months, they should respond to their name. All infants will have a hearing screening test while in the hospital shortly after birth. If they fail the test twice, they're given a consultation for an audiology clinic where they should be evaluated before they are 3 months old. Risk factors for hearing loss include structural anomalies, history of family hearing loss, pre- or postnatal infections, and persistent otitis media. See box 6-1 for language milestones. The social smile develops at about 3 to 5 weeks. If they do not display this by age 8 to 12 weeks, then they need to follow up closely and be closely monitored for developmental delays. Most infants can make non-meaningful sounds by 4 to 6 months and meaningful sounds by 9 to 15 months. Infants with older siblings may meet these milestones earlier. Erikson's theory has infants at trust versus mistrust. If they receive consistent, satisfying experiences, they will develop trust. If their needs are not fulfilled, like they're not getting fed often, crying without being consoled, then they will have mistrust. They need the parent-infant attachment to reach the psychosocial milestones. The parent has to be able to adapt and meet the infant's needs for that attachment to occur. The parent will feel the attachment as well when the infant quiets, when they console, or smiling at them. The infant needs social interaction within the family. Touch is important to the infant to express a sense of caring. Another important aspect of the psychosocial development is stranger anxiety. By about 6 to 7 months, the infant is able to differentiate between their parents or caregivers and strangers. The infant can show signs of anxiety towards strangers by clinging to the parents, crying, and turning away from the stranger. This behavior peaks at about 7 to 9 months and then again during toddlerhood. This is a normal behavior and the separation should be done quickly, but with care and love and emphasis on the parent's return. Nutrition during the first year is crucial to form all forms of development. We have discussed breastfeeding and formula feeding earlier. Either way they choose to be fed, we must support and provide education to help with the success of the method they chose. Vitamin D supplements are recommended for all breastfed infants to reduce the risk for getting rickets. This is also true for formula-fed infants who consume less than 1 liter of vitamin D fortified formula each day. They may also need iron supplements as well. If they're formula feeding, the formula needs to be iron fortified. Cow's milk is not recommended until the infant reaches 12 months. Infants are at various ages when they show signs of weaning from the bottle or breastfeeding. These include throwing the bottle, biting at the nipple, taking only a few ounces of formula or refusing the breast, or being very slow at eating. Many infants will show less interest in bottles or breast when they start eating more solid foods. Parents should be advised not to wean during the time of stress for an infant. Offering a sippy cup is one option for the weaning process. Once an infant can take fluids from a cup, the parent can introduce juice in small amounts, no more than 4 to 6 ounces a day. They should not be given to the infants less than 6 months old and not given at bedtime to decrease the risk of tooth decay. If there's a family history of oranges and tomatoes, family history of oranges and tomato allergies, those juices should be avoided until 12 months. Teach parents to read the food labels. When solid foods are introduced, a small amount of additional water may be needed, but they typically do not need extra water intake. Solid foods should be introduced between 4 to 6 months depending on the provider input. See box 6.3 for readiness for introduction to solid foods. Iron-fortified cereal is often recommended as the first food to introduce due to the ease of digestion and the low risk for allergies. It does not matter the order of other foods that are introduced. They should not be mixed with formula and put into a bottle with a larger hole. Parents can steam vegetables and puree to make their own baby food at home. They should not give home-prepared orange or green leafy vegetables as they may contain high levels of nitrates. Salt and sugar should not be added to foods. Honey should be avoided until at least 12 months to reduce the risk of botulism. At about 8 to 10 months, finger foods can be introduced. They have developed that pincer grasp so they can pick up the foods. These foods need to be in small pieces to avoid choking. Newborns can sleep up to 17 to 20 hours a day. As they are near 3 to 4 months, most will sleep longer stretches at night. Many times parents have unrealistic goals when it comes to infants sleeping, so anticipatory guidance on what to expect can help with this. We must educate on the importance of establishing a sleep routine for the infants. Putting the child to sleep while awake helps them learn self-consoling techniques. The sleep environment is important in preventing sudden, unexpected infant death known as SUID. The CDC describes it as sudden death by either SIDS, unknown cause, or death by suffocation or strangulation. The infant should always be placed on their backs to sleep. They should sleep in the parent's room, but not in the parent's bed, and not near windows or windows with cords. Use mattresses that come with the crib and that fit tightly in the crib, no soft or loose bedding. Also, they should not be placed to sleep in their car seats, infant seats, or any other equipment that keeps them in the upright position. Avoid feeding while sitting in an upholstered or soft furniture. Avoid secondhand smoke and overheating. Do not attach a pacifier by a string to the infant, and breastfeeding can reduce this risk as well.